All right, everyone. Well, thank you so much for being here today. It is absolutely our pleasure to have Dr. Cynthia Monheim-Janss with us to present this topic. And we really gravitated toward medical stress and trauma as a topic because of other virtual programming that we had been doing. And you guys really had amazing suggestions and also some significant experiences that we really wanted to address this topic so we can all kind of unpack where we are and also share with each other and learn some ways to help us be better prepared to handle medical and stress currently and in the future and model good behavior for our kids. So I would like to introduce Dr. Monheim-Janss. She is a clinical psychologist in the Cleft and Craniofacial Center at Barrow Neurological Institute. And her expertise includes helping children and their family navigate medical treatments, surgeries, and other challenges associated with complex chronic health conditions, including craniofacial and neurological disorders. She is trained in psychosocial, neuropsychological, and pre-surgical evaluations, as well as medical psychotherapy and medical team consultations. She's a member of the American Psychological Association, the International Neuropsychological Society, and the Society of Pediatric Psychology. Dr. Monheim-Janss earned her master's and doctorate degrees in clinical psychology from the University of Arizona, where she also completed an internship in neuropsychology, and she completed a fellowship in pediatric psychology at Children's Rehabilitative Services at St. Joseph's Hospital and Medical Center. And so we're just super glad that she's with us today. She's also been a part of CCA at our in-person retreat, and we had a great session there. Everyone really enjoyed it. So we're super glad that she's going to talk to us today about medical stress and trauma. And just as a reminder for everyone on the call, we are here for educational and informational purposes, also connection and sharing, but we are not giving specific medical advice or diagnosing or treating anyone on this call, but this can certainly help you start the process to find medical care if you need it. And if you want to reach out, we can direct you to some facial centers in your area. And with that, just some housekeeping. Keep yourself on mute if you don't mind while we're in the presentation. We do have 2 sessions where we'll break out, and we'll break out into adult patients and parents. And if maybe you have 2 people in the room or you fit into 2 categories, just select the breakout room that you most identify with. And what you can do is if you can rename yourself and just put at the front adult or parent in the next few minutes, that will help me sort you into your rooms. Obviously, I know a lot of you and I can put you in a room, but I also want to make sure you're going into the room that you want to talk to other folks. So if you want to talk to parents and learn about modeling behavior, you would select parent. And if you're working on yourself, whether you're a parent or not, that would be the adult group. All right, I think that's everything. So with that, I am going to turn it over to Dr. Monheim-Janss.
Thank you, Erica, and thanks for letting me participate in this. I had so much fun in Scottsdale at the CCA conference, and I'm so glad that people are interested in kind of understanding this complex issue of medical trauma, because we know that it can affect kids and parents. We know that we have great coping skills, resilient skills, but then sometimes some of these issues kind of hang on and start to get in our way. And then we start to think about that as medical trauma or medical traumatic stress. My role is usually working with individual families and patients. And so tonight I hope to just go through kind of the discussion and some of the information that I share with individual families about this concept, but we're going to do it in a big group. Thank you for submitting questions. There's some great questions. Let me just pull up a couple of them. And these are the kinds of things that hopefully we'll target tonight. What are some tips for recognizing and alleviating medical PTSD or medical stress attacks? What do I do before, during, and after a medical interaction, maybe to mitigate the impact of trauma or PTSD symptoms? How can parents and medical providers identify a patient experiencing or that may experience PTSD when in a hospital or at doctor's appointments? Great questions. And then, is PTSD more prevalent if you have other anxiety or mental health issues? Okay, these are great questions. And I know there are a lot more. We won't be able to get to everything, but I think what I'd like to do is really focus on talking about medical traumatic stress and how that's kind of part of the continuum of stress reactions. And at the end of that continuum, we call those most severe cases, PTSD. So we're going to be kind of talking a little bit about PTSD, but mostly about all the stuff that falls in kind of the middle, because we can have experiences that are traumatic, how we think about things, but it may not qualify for a full diagnosis of PTSD. Okay, but we should pay attention to it nonetheless. And there's a lot we can do to understand it, manage it, and kind of help our children navigate through the world of medical stressful situations. Okay, so we'll talk a little bit about PTSD, but mostly we're going to talk about medical traumatic stress, which comes in a lot of different shapes and forms. Okay, we'll have 2 breakout groups, like Erica said, and I will try not to talk too much. Okay, so I love the brain, and usually I draw this on my whiteboard, but I made a nice slide for you guys. When we talk about our brain and how we respond to things, especially traumatic or stressful or threatening kinds of events, I like to talk about we have 2 brains in one mind. So we've got our logical brain, which is kind of up here. It's our, logical, clever, thinking, planning brain where we keep all our information. But then we have this primitive brain, and we can call it the survival brain. Sometimes I call it the lizard brain, but it's mostly comprised of what we call the limbic system, which is a very important part, a very emotional part of our being, but it's very primitive and it can only do a few things. Its main job is to keep us safe, keep us protected, and to kind of identify danger and cause us to react to danger. Okay, it's the fight or flight response, except I call it the fight, flee, and freeze response, because we have another piece in there, the freeze, that can take over. Okay, so when we talk about we're going to talk today a little bit about strategies and responses, and I'm going to refer to the logical brain, which is the one that we're all using right now. And then I'm going to refer to the survival brain, which is that one that kind of can take over and kind of shift the way we think, shift the way we feel, shift the way our body responds. Okay. And in medical traumatic stress, right, when we talk about stressful events, there are things that will happen in the moment, right? Getting an IV, getting ready for surgery. Those are all stressful events. And we can talk about how to cope and how to respond. But then after the event, after it's over, after we're kind of out of that situation, if we still have some lingering symptoms, or we have some lingering memories that kind of change the way then we start to react in the future to medical visits, then those are the things that we call traumatic stress reactions. Okay, so we've got logical brain, and then we've got kind of our survival brain. We need them both. They're both important. But if we can keep our logical brain kind of in charge of things, it feels so much better. It allows us to kind of access all our knowledge, our coping skills. But the survival brain, the goal of survival brain is to kind of hijack our thinking, right? So, if we are, I use the lizard metaphor, the lizard brain. Out here in Arizona, we have a lot of lizards around. Lizards are not very smart. And if a bird or predator is coming for them, they really can only do 3 things. They will fight, they will flee, or they will freeze. Okay, well, thank you for switching the slide. Now, lizards are not very good fighters. They really don't have any skills. So lizards really don't fight. Flee just means run away, get out of there as fast as possible. And then freeze is kind of a shutdown. Maybe I can freeze. The threat won't see me. The predator won't see me. I just be really still and maybe the danger will pass. Okay. So we know we have so many more coping skills than that. We have so much more understanding than that. But when we're in the moment, if our survival brain takes over, if we feel overwhelmed and that lizard brain takes over, we really fall back on just 3 kind of responses. Okay. So let's talk about how those show up in kids and parents. And then, I think it'll make some sense. And then in the breakout rooms, we're going to start to talk about what we see maybe in ourselves as parents or in our kids or in ourselves as patients, okay, as we're managing some of these. So the fight response, right? You can think of yelling, making fists, kicking. So little kids, when they're feeling overwhelmed in a medical situation, will do these things. As adults, we don't do that. We learn that we have to kind of suppress that fight response, and it comes out in different ways. Okay. So one of the things that we will talk about today is identifying how the fight response might come out in you as a parent or you as a patient or your child as a patient, right? What are the things that we know happen when our body gets ready to fight? Muscle tension. We usually change our expression. We get our arms tight, ready to maybe punch. Our breathing changes. We may start to feel kind of these angry, aggressive kind of thoughts in our head as parents. The big fight response is that urge to protect our child, kind of that mama bear or papa bear response. Okay. So the fight response is a natural response when we feel threatened, but if we don't kind of recognize how it's impacting us, then it can start to kind of get in the way a little bit. Now, flee. I've had little ones literally just try to run out of the room, right? They see, and I don't do the shots, but we've all had kids or experienced going in for an injection. You see the shot and you want to just run away. When we know we can't run away, but we experience that flee feeling, we might notice that our legs are getting bouncy or jittery because our survival brain has told our legs, all right, you got to get ready to run, even though I'm going to stay here and listen to this or stay for this experience. My legs are running. Maybe I'm tense. Maybe we get stomach changes because when our survival brain gets activated, it shifts the blood, takes it from our stomach and sends it out to our legs and muscles to get ready to run. Okay. I've had kids crawl under the table, cover their face, kind of, if I can't see, I'm not here. I've had teenagers and older kids take a bathroom break and not come back, right? And so it's a socially acceptable kind of flee, but it's a recognition of, I need to get out of this situation. It's too overwhelming. Okay. And then the freeze response. We can see this in younger kids, especially if they've had a lot of medical challenges, a lot of unpleasant medical experiences, where we just see somebody kind of shut down. Okay. Not making eye contact, not talking. Usually there's a pretty tight protective body, try to be real small. And as adults, whether we're parents or patients, we can experience this too, kind of this not being able to feel like we can speak, say the things that we want to say, find it hard to make eye contact with the provider. Suddenly we can't ask the questions that we knew we wanted to ask when we get into that situation. Heart rate changes, our breathing slows down. Sometimes we even feel faint, right? So these physical pieces of the survival brain and the kind of overwhelming trauma response, these physical responses are so real. And sometimes we just haven't learned to kind of pay attention to them, okay? Now, when I talk to families, we just put it out there that families who have been going through treatment for craniofacial conditions, those families and children in the first 10 years of their life have more medical procedures, more medical challenges than most people have in their entire lifetime, right? And most of those challenges we get through, and we get through that the episode, and we come out kind of stronger and more resilient. Not always. If we kind of are, if we experience that medical trauma as really overwhelming, right? Overwhelming physically and then also cognitively. It can leave us feeling more fragile. It can leave us feeling a little bit more vulnerable, okay? So we've talked about the body responses, some of the physical responses. There's also the mind responses, right? So when our logical brain is functioning well, we can kind of call on our strong thoughts, I call them with kids, or our strength responses. Hey, I got through that, right? I can get through anything now. Wow, I did it. I'm stronger than I thought. Whoa, next time it'll be even easier. I got this, right? But if our survival brain really starts to take over and we're feeling overwhelmed, sometimes those responses that are not so helpful kind of start cycling through our head. And that's important to notice because we have some control over that. The responses that can go through our head that make us feel more fragile is, oh my gosh, I almost didn't make it. That was the worst thing that ever happened to me. I could never handle that again, right? All those things, they're normal kind of thoughts to have pass through our head. But we also have a choice in whether or not we continue to listen to them or we kind of can regroup. Okay, so the important part in talking about traumatic stress, medical traumatic stress, is that we have to start with kind of building an awareness of what our physical responses to medically threatening situations are, or medically different situations are, and what are our thought responses, right? Once we start to become aware of those, once we start to notice them, then we have some power to really start to manage them, okay? I feel like I went through that pretty fast, but would now be an okay time to do the breakout activity and to, okay, so could you pull up the slide, Erica, noticing your stress response? Okay. And I think what we can do is talk about whether, you can focus on your own kind of things you've noticed as a parent or as an adult, or you can talk about things that you've noticed in your child, okay? And then I'd like to have some discussion about how all these different symptoms can show up, okay? So you might notice, you might try, if you choose the first question, try to identify what are some freeze responses that you've experienced or seen somebody you care about experience. What are the fight responses? What are the flee responses? And maybe you have more than one going on at the same time, which can be extra stressful. Okay. Another piece about the awareness is what are some of the early triggers that might get your stress response going, right? Sometimes it happens with getting the notice that your follow-up appointment is due. Sometimes it's maybe driving into the parking lot and seeing the building, the medical building. We've had some families talk about they're okay until they get to the elevator and push the elevator door to the clinic. And then that's where they start to kind of feel the physical symptoms and maybe some of the overwhelming thoughts. Okay. And then here's another piece. What are some of the earliest physical symptoms maybe you notice in yourself when you're stressed? Just regular stress. Is it clenching a jaw? That's what I do. Is it starting to kind of feel irritable? These are all signs that maybe our survival brain is kind of taking over because we feel threatened, right? And it's not allowing us to really use our logical brain to kind of step in and do the calming responses, do kind of the logical thinking that helps bring us down. And then what are the coping skills that you know work for you? What are the coping skills that you can try next time when you're noticing these first signs of stress? And we'll talk about some of these. Deep breaths are great. I know they sound simple. I bet everybody's using deep breaths in lots of situations, but physiologically, they reset that stress response. And so they're so powerful. Distraction is a great one, being able to turn our music on, being able to take our mind off focusing on the worry. Coping thoughts or strong thoughts. Yeah, this is tough, but I can get through it. Being able to exercise before or after kind of the stressful appointment, if it's a consultation, to get that stress out of our body. So Erica, I'll let you kind of navigate the breakout rooms and kind of lead people through that. And then I'm excited to hear what some of the responses are to these.
Sure. All right. I have a lot of folks assigned, so I'm going to open the rooms. And if you're not in a room, then we will get you in a room. You'll stay in here with me and I'll get you in the room that you want to go in. So I'm going to open the rooms. And Dr. Monheim-Janss, how long should we stay?
Oops. Maybe five or 6 minutes, and then we'll have some discussion.
Okay, perfect. We'll do 5 to 6 minutes and we'll bring us all back. All righty, here we go.
So many important things. We won't be able to unpack all of them. But the thing I'm so glad that you brought up is that medical trauma, especially for craniofacial conditions, is different than kind of the trauma or PTSD that we hear about kind of out in the world. Because most of us talk about trauma or PTSD as one event that happens and then, we go on. But I love that you brought up the point that, as a child and as a family, we're continuing to go through these ups and downs, right? Just going through these medical crises that take the form of surgery, but also we have to put kind of life on hold for a while. I know so many families that the summer is reserved for the surgery and the recovery, and they don't get to have kind of that summer break that everybody else just kind of takes it for granted, So thank you for bringing that up, because it's something that's very unique to craniofacial, because the treatment kind of continues throughout different parts of the lifespan, especially as a child. And I think you described it so vividly, feeling like, carefree, and then all of a sudden the weight of the world comes on me because I realize there's another surgery coming up right around the corner. Thank you for bringing that up.
Sure. And we'll get who has their hands up, and then
so for me, I had to write things down so I would remember, because I'm listening to everyone. Probably, full disclosure, I'm a trained counselor, but my logical brain could not protect me from my fight or flight response when I was anticipating an awful surgery coming up for my daughter. I was fighting against months of missing work again for all the pre-surgery things, missing money. And so I learned the hard way prior to my daughter's C1, C2 spinal fusion. So look at a picture of a doll baby wearing that big metal thing. That's one thing when it's a doll baby, and I can still see it today. But then seeing her after surgery, seeing her in the recovery room in ICU, I felt like a Mack truck hit me in my chest. But my usual response prior to the surgery and that day was ignore my stress, ignore my symptoms. I had every symptom that said, girl, you better go check yourself out. Ignored my doctor, ignored everybody. And the result was, Brittany, she recovered from 3 months after that C1, C2 spinal fusion. She had 5 procedures that day, 12 hours. I'm scared to death. And she did not look like my child when I saw her. So when I say I felt like a truck hit me in my chest, what I experienced was the beginning of a long, ugly bout of AFib that almost took me out. So my anticipation, several months of anticipation before the surgery, it left me unable to sleep. I was mentally and physically exhausted. And the best thing that happened for me after that medical situation, once my body fell apart 2 days after her surgery, she went back to school in 3 months. I didn't go back for 9 months because I was at stroke level. So when I say almost was out, I was almost out. The best thing I did was I went back to my training. I went to therapy. I did drug and talk therapy. Best thing I could have done for 5 months, 5 of those months, got myself back together. And I learned to recognize my symptoms of tightening stomach, that couldn't breathe. I learned to just slow down, take a book to the next surgery, take my little iPod, or old school iPod, to take music. Now I can look at social media, but I learned the hard way, and I will not go back down that road again because I almost checked out, didn't want to do that. So therapy was awesome. I reconnected to the deep breathing. I reconnected to reaching out to a support system, having somebody to talk to, somebody to listen to me, or somebody to just sit quietly with me. Bottom line is, my blessing at this point is that she started first surgery at 5 months old. She's almost 31. And I learned, and I will not go back down the rabbit hole for me anyway. My blessing is I've had my training, and doctor will say this, my training constantly is reinforced. But listen to your body. Please don't ignore those symptoms. Reach out for help. And don't, get that S off your chest, Superman, Superwoman, do what you need to do, but slow down, take care of you so that you can take care of your loved ones and yourself. That's it.
Thank you so much, 𝐼𝐬𝐼𝐻.
Coping skill that you know is going to work for you, and taking it with you, even if it's to a consult where nothing's going to happen, you're just talking, can really help keep that stress level in a manageable range. Know what your coping skills are, know what works for you.
Definitely. We're going a little bit over time. We definitely have about 10 more minutes. So Dr. Monheim-Janss, how would you like to take these next 10 minutes? What do you think?
I think we've kind of covered some of the pieces of the next breakout section already. So we've talked about skills and okay. So just briefly, I want to talk about, and 𝐼𝐬𝐼𝐻, I know you're a professional too, so feel free to add to this. When we talk about treatment for traumatic stress or medical traumatic stress, we talk about making sure you have a provider who knows about kind of trauma therapy, right? And the most common, the one that we talk about the most is a cognitive behavioral therapy, which is like a talk therapy, but it focuses on what our thoughts, what's going on in our head, recognizing what's going on in our body, and then being able to start to make some changes there. So we have some choices in situations. So it's an awareness and then being able to make choices. And there are different versions of cognitive behavioral therapy. And so that kind of talk therapy, we know can work really well. Prolonged exposure, we had a question earlier about, does exposure therapy, like the kind of treatment that somebody might have, medication, I know we have lots of research on the kinds of medication that can be helpful in treating trauma disorders and PTSD. And so what you see on the screen there, I pulled that from the American Psychological Association website. And if you go to treatment in detail and kind of how they've made decisions about what are efficacious treatments or what treatments they recommend. And then I really like at the bottom, the 7 tools for managing traumatic stress. And it's from the NAMI website, but it's a bullet point list of specific breathing and specific kind of almost meditation, but really easy to do, easy to take anywhere, strategies that can help you center to the present moment, like everyone's been talking about, and take you out of your head, out of the survival, anxious thought pattern, and bring you back to the present moment, where I think somebody said, we're always fine in the present moment. And if we can get to the present moment by doing a 5 senses activity, which you'll see on this skills sheet, or some breathing activities, it can bring us back to a place that feels so much more manageable. And then we can activate that logical brain and be a part of the discussion, be a part of the planning, be a part of the, of the solution.
About 3 to 4 minutes. 𝐼𝐬𝐼𝐻, would you like to go ahead and offer us your comment.
Yeah, the one comment I wanted to make, it's for both ends of the spectrum. If you're an adult who's affected or child, or if you're a parent who's watching the situation, other children or siblings in the home. One of the big challenges that happens is the affected individual, they tend to get most of the attention. And one of the things that always challenged me was how to not feel guilty when my son, who was fabulous and healthy, he wasn't getting attention from me because everything went to my sick child. That was a huge challenge. So if you're the brother or sister of someone who is always back and forth to the hospital, sometimes you get left out. And parents feel tremendous guilt and challenges. And you want to care for the one who's got the physical issues going on, but then how do you protect the one who's so-called normal and everything is okay? How do you still let them, protect them and make them feel good while the challenges are going on? So very often parents, people forget that there are other people in the household who are tremendously affected by what's going on with the person who's having surgery after surgery. And sometimes they're there. So that was it.
And Herlena, thank you for bringing that up, because siblings, we haven't even touched on siblings. Thank you for bringing that up.
Mm-hmm.
And I love the parent perspective. I talk to siblings, and siblings go through a lot of complicated experiences. That, like you said, they feel like they've maybe been neglected at times, but they also can feel tremendous guilt, fear. Why is this happening to my sibling and I'm totally fine? And they feel tremendous empathy to their parents because they see how much the parents are struggling with the medical issues, and maybe even kind of pull themselves back and say, maybe I don't really need that much help. I don't want to put extra stress on my parents. And so thank you for bringing up siblings. It's a whole, it can be a whole group in itself to, address the complexities there, but thank you.
Definitely. There's a few things that I thought I would just mention that when we were planning for this, we definitely want to do more of this. So if you're interested in continuing this conversation as an adult, we have adult monthly meetups, and we'll be continuing to do more groups for parents to talk about this. I would encourage everyone to kind of ask yourself, am I trying to prevent or accept or overcome medical stress and trauma, and really decide where you're at and kind of research into that? Because if you're trying to prevent it in your child and your family, you can take steps early on. And if you're an adult trying to overcome some of the reactions, there are different steps. And we definitely encourage you to reach out to CCA. We can match you with people who are working on these things and talking about these things for some more discussion and further education. And then I think the biggest thing, I don't know if you touched on it in the parent group, but it's actually been very effective in my own family, is to not push down what your lizard brain is telling you. So parents, one of the best thing is, I've even seen my sister do this with my nephew. Like, if your parent heart is racing, you can tell your child, oh, feel my heart. My lizard brain is saying it's nervous, but we know it's going to be okay. So trying not to hide that bodily response, because that's when we experience this delayed onset, and then we're so much more enmeshed with our problems that, like me, I'm a fainter. I'm a delayed fainter. So these are all things that we here at CCA we've experienced, and we want to keep the conversation going, even though we can't talk too much longer tonight. But Dr. Monheim-Janss, would you like to offer any final words, or if anyone has any final comments, we can wrap up tonight.
I'll just say thank you for letting me participate in this. What an amazing group. It's the biggest parent group that I've ever worked with on this particular topic. And I'll just echo what Erica said, right? Understanding what is our response as parents, and then being able to identify that and activate our coping skills in our mind, activate the coping skills for our body, and then let our children see us doing that. And I love Erica verbalizing, this is what's happening, and here's how we can bring it back down. So thank you so much. And, I love that people are starting to talk about this and starting to explore this. And thank you for sharing. I know that's not easy to do. So thank you.
Absolutely. Thank you so much, Dr. Monheim-Janss and Harlena and everyone who shared. This is how we change things for the future.